Hi, I'm Dr. Johnson.
And I'm Dr. Rill.
Today we're going to talk about how we diagnose the different injuries we see in a motor vehicle collision, whether it's a whiplash injury, whether it's a concussion, whether it's a knee or elbow contusion, potentially herniated disc, or even occasionally fractures. So what's the best tool we use, Dr. Rill, when we're trying to diagnose, let's say, a whiplash?
Yeah, so just like with most of the times when you're diagnosing, any condition, a good thorough history, and then obviously a good thorough orthopedic and neurological evaluation is going to give us the findings that's going to be indicative of a whiplash type injury, where they're going to be having lots of spasm, tightness, limited range of motion. If it's significant, we could have some neurological signs like radiating pain into the arms, legs, things like that.
And if we see someone who's maybe injured, like their knees hitting the dashboard or their elbows hitting the side, we may see bruising, we may see swelling. So with those injuries, we always send out for x-rays to make sure, A, that it's just a contusion and not a fracture. Especially in the wrist as well, when you're gripping the steering wheel, you get hit, it can cause the wrist to kind of bend backwards, and potentially, again, wrist contusions, wrist swelling, or wrist sprain, or even sometimes occasionally a wrist fracture. The other big issue we see all the time is a concussion. And many people don't think they have one when they initially come into the office, but how do we know typically they have one when they come in?
Yeah,
What's
so
our procedure?
Yeah, so we'll ask them some certain questions about, like, one, did you hit your head? Two, are you having any headaches? And then neurological things like brain fog, loss of memory, simple things. You ask them, like, have you noticed that you don't find your keys or your cell phone, you misplace things more frequently than you did prior to the accident? These are things that people don't always kind of correlate, but that the brain's just not functioning at the ability that it really has the ability to perform.
So if you come to us and we do a workup, we find you have a contusion or potential fracture or concussion, we will then potentially refer out to orthopedist or a concussion clinic that can do further diagnosis and diagnostic workup to make sure you're getting the best care possible. In the fourth video of this series, we'll then talk about treatment. I'm Dr. Rill.
I'm Dr. Johnson.
I'm Dr. Johnson. This is Dr.
I'm
Rill.
Dr. Rill.
We're the chiropractor at Johnson Chiropractic and Rehabilitation.